We had a survey of our members over the weekend ahead of the Prime Minister's announcement on Sunday night, and they reported 67% of them felt that they had an increase in their anxiety levels at the prospect of lifting or easing of the restrictions that were announced. And of those, the biggest fear was of contracting the virus, where 57% of respondents to our survey cited the fear of contracting the virus as their biggest concern.
So what coping strategies should members of the public use? Because that concern about contracting the virus, we know we're going to have to learn to live with it for a while to come. So what can individuals do?
Well, we need to take time. We need to give people time and space to get used to returning to normal. You know, after being inside for such a long time, it's obviously going to feel really strange, and it's going to be challenging for people to start to return to their pre-pandemic routine. So it's expected, and that's perfectly normal. And particularly for those with pre-existing anxiety disorders, the easing of the lockdown may well exacerbate that anxiety. It's essential, therefore, that as we release the restrictions, we let people return to normal, that we make additional support available for that group of people. So whether that's returning to their normal access to mental health treatments, to face-to-face therapy, or whatever support that they are needing, then it's essential that they have that support available to them to help them return to that normal pre-pandemic routine.
When you're talking about support, what kind of things do you mean? What needs to be put in place? Because it's not just people with mental health problems who are feeling anxious. This is something that large swathes of society are going through.
It is, and I think, you know, making sure that we've got the balance right between putting protections in place and encouraging people to either wear face masks in public or on public transport, or whatever other precautions we might ask them to take. That's obviously an important aspect of it, but we need to recognise for some people that will cause them fear, that will cause them anxiety, that will cause them worry. So we need to get that balance right. We need to be mindful of that. We need to give people access to the mental health support that they need, whether it's therapy, whether it's anxiety support groups, whatever help and support we can put in place for those people to help them adjust to the new circumstances that we're all having to face is going to be critical.